Now I am going to discuss the rheumatoid arthritis morphology. First of all, I will discuss the changes in the joints. Basically, the joints which are involved in the rheumatoid arthritis are the small joints of hands and feet. And what changes we can see in the synovium? The synovium become edematous, thickened, hyperplastic, which is covered by the delicate and the bulbous villi. Histologically, we can see synovial cells hyperplasia and the proliferation. There is also dense inflammatory infiltrate which are forming the lymphoid follicle, and these infiltrates or the lymphoid follicle containing the CD4 helper T cells, B cells, plasma cells, dendritic cells and the macrophages. There is increased vascularity due to the angiogenesis. Why there is increased vascularity? Increased vascularity because it's a chronic disorder. There is also presence of the fibrinopurulent exudate on the synovial and the joint surface. It is also showing it is a chronic disease, and osteoclastic activity which allow the synovium to penetrate the bone and form the subchondral cyst and the periarticular erosion. For example, these are the two bones and the synovium present between these two bones. When there is rheumatoid arthritis, there is a stimulation of the cytokines or the stimulation of the synovial cells, which ultimately stimulate the osteoclastic cells present in the bone, and the stimulation of osteoclastic cells will form the cavity which lead to the formation of the subchondral cyst due to the penetration of the synovium into the subchondral space. There is also damage to this periarticular cartilage, and all these changes will lead to the formation of the pannus. What is pannus? It's the mass of the edematous synovium along with the inflammatory cells, granulation tissues and the fibroblast. And this is, for example, this is the pannus which contain the edematous synovium, inflammatory cells, granulation tissues and the fibroblast. Now cartilage will grow over it. There is a growth of the cartilage over it, but this cartilage will be eroded soon, and after the destruction of this cartilage, the pannus bridges the opposing bones to form a fibrous ankylosis. When there is a damage to this cartilage, and these two bones and the pannus is present between these two bones, and this pannus is going to bridge these two opposite bones with the help of fibrous tissues. So when there is a bridging of two opposing bone with the help of a fibrous tissue is known as the fibrous ankylosis, and this fibrous ankylosis will become ossified and will lead to the permanent fusion of the two bones, and this permanent fusion of the two bones due to the calcification or ossification of this fibrous ankylosis will lead to the formation of the bony ankylosis. What changes we can see in the blood vessels? The changes we can see in the blood vessels is the acute necrotizing vasculitis, which involving the small and the large arteries. It may also involve the pleura, the pericardium, lung, and the chronic fibrosing process. As other changes we can see there is involvement of the small artery segment like vasa vasorum or the digital arteries, and these arteries will be obstructed by the obliterating end arthritis, and this obstruction leads to the peripheral neuropathy or the ischemia, which lead to the further ulcerations and the gangrene formation. Other than the acute necrotizing vasculitis, there is a leukocytoclastic vasculitis, and which lead to the formation of the purpura, the cutaneous ulcers, nail bed infections, and we can see also ocular changes. We can also see the ocular changes in the leukocytoclastic vasculitis like uveitis and the keratoconjunctivitis, and these changes are similar to the Sjogren syndrome. In the skin, we can see the rheumatoid cutaneous nodules, which is present in the 25% of individuals. These nodules are present in the region of the skin which are subjected to the high pressure, like the ulnar aspect of the forearm, elbows, occiput and the lumbosacral area. Less commonly it will involve the lungs, heart valve, spleen, myocardium, pericardium, other viscera and the aorta. These nodules are the firm and the non-tender, round to oval in the subcutaneous tissues. Microscopically it will resemble necrotizing granulomas, and these granulomas will have the centrally placed fibroid necrosis, and along this fibroid necrosis is surrounded by the stimulated macrophages as well as the lymphocyte, mainly containing the plasma cells.